Dr. Henry, so people in communities in BC's north who want to get their children vaccinated are concerned about the lack of appointment times. In Prince George, it seems there are only 6 days between now and Christmas when children vaccination clinics are being held. Is there a plan to increase that so more people can access vaccines for their children?
Absolutely, and maybe I'll turn it over to the minister because, yes, we are planning across the province. It's been a challenge in the last few days for many reasons, but yes, there is a plan.
And I think with respect to the North, I'd say that people should know that the details of timing of vaccine arrivals, which come directly to regions from the central federal depot, were quite uncertain last week, and the vaccines in the North were late arriving, and this did and has affected the early appointments. So once the vaccines arrive in a health authority from those depots, the federal government depots, or from manufacturers, vaccine has to be unpacked, divided up, repacked, and placed on trucks for distribution far and wide to communities across the health authorities. This takes significant time and has to align with very particular cold chain requirements. It's because of that we've been doing so much work to prepare our pharmacy system, and I may talk about that briefly in a second. So it takes vaccine, for example, 6 to 8 hours to thaw before it's ready to use in clinics, and the delay in arrival makes it a challenge, especially with some of the significant weather we're seeing around the province. For that reason, Northern Health has a practice of delaying 1 to 2 days beyond the rest of the province in timing and scheduling of clinics in order to risk manage the risk of having to reschedule large numbers of residents when vaccine doesn't arrive on time. So the decision was made to defer the start of the NHA and IHA campaign to Wednesday, December 1st to ensure the availability of vaccine in every clinic. And needless to say, it's a priority in the North because we continue to see higher transmission in the North. It should be said that test positivity in the North is coming down, which is a good sign. It's still dramatically higher than the provincial average. It has come down from a 7-day rolling average of around 20% through much of October and November to about 12% as of today, which is good news. Of course, test positivity across the province is down at 3%, which is considerably below as well for the province as a whole, but the North is a priority. We've made, I think, extraordinary progress in the North with our immunization clinics for first and second doses. It's a priority, obviously, for booster doses everywhere in the province, and we're going to continue to do that. I just want to say finally that we have, and Dr. Henry referred to this, people are asking, I think, how you're going to do all this, that we have a very significant number of children. There are about 349,000 children between 5 and 11 in BC. How are you going to do that? And the booster doses and the continuing first and second doses. And part of that is the work we've been doing with the BC Pharmacy Association since August to prepare the pharmacy sector to be a major player. To date, and Dr. Henry referred to this, we have about 200 pharmacies able to offer appointments and COVID-19 vaccinations through IMS BC. By the end of next week, there'll be a further 300 added. And by early January 2022, there will be up to 1,000 pharmacies involved. So increasingly, pharmacies are going to take on the burden and the responsibility, and the extraordinary responsibility of the booster dose campaign, or a much greater share of it in the future as we focus on vaccinating children 5 to 11 in the months of December and January. I also want to say finally, 1,056,000 influenza vaccines have been administered in BC. 1,056,414 have been administered as of November 29th, and we tend to get more. It's more delayed data in that case, but that is a significant number. It's at least that, and more than 800,000 of those have been done by community pharmacy. So community pharmacy is a big part of our campaign. You're going to see that in the coming while, and the North is absolutely a priority for vaccination. You've seen this in the relentless effort to vaccinate people that's been led as well by community leaders in the North, and we're very appreciative of that.